Hello. Welcome to the Pars Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about the 10 daily habits that contribute to or cause knee pain. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. You can develop knee pain at any age for a variety of reasons. While it's common to experience severe injuries like tears and broken bones, you can also end up with knee pain because of medical conditions, like rheumatoid arthritis and infections. Your knees also take a beating daily, leading to overuse and degenerative issues, like osteoarthritis. While you can't always prevent knee pain from developing, several things can put additional stress on these joints and trigger your symptoms. In today's video, we are going to be sharing with you 10 habits that cause knee pain. So, stay tuned. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Number 10. Carrying excess weight. Being overweight is a surefire way to put added tension on your knees. When you're overweight, each extra pound puts up to 3 pounds of added pressure on your knees when you walk. If you run, it more than triples. This added stress on your joints significantly increases your chances of having osteoarthritis and can even accelerate the degeneration of cartilage in your knees. Your cartilage is the protective tissue cushioning your joints that enables smooth and comfortable movement. However, when overweight men and women lost an average of 11 pounds, they reduced their risk of osteoarthritis by half. Number 9. Wearing the wrong shoes. Think those high heels or flip-flops are making a fashion statement? Wearing the wrong shoes can also put unwanted stress on your knee joints. To ensure proper weight distribution throughout your body, focus on wearing high-quality shoes that support your feet during physical activity, and address any anatomical considerations. Common issues that can lead to knee pain include flat or rigid arches, overpronation or supination foot rotation, and bowed legs. You can also get orthotic inserts to wear inside your shoes that address many issues and relieve pressure on your knees. Number 8. Standing or sitting too long. Even when you're on your feet, your knee may get stiff and sore over time if you don't vary your position. Be sure you shift your weight from foot to foot if your job requires long-term standing. Try to take a sitting break now and then. Conversely, if you sit all day long at your job, get up every half hour and move around the office, or take a walk outside for at least 5 minutes. You won't just be helping your knee, either. The medical community recommends 5-minute breaks every 30 minutes to ward off killers such as heart disease. Number 7. Working out without warming up. Maybe you're all in for adding more activity into your life. You are going to exercise to get health benefits, but when you start your exercise without warming up or finish it without cooling down, it will hurt your joints and especially your knees a lot. Take at least 10 minutes to stretch your legs, warming up all of your muscles, tendons, and ligaments so they can take the stress of the coming workout. Number 6. Locking your knees. Over-straightening or locking your knees during exercise can harm them. Always stay just short of the locked position so that your knee remains flexible and can adjust to the forces of your exercise routine. If you have a knee injury and like to work out, consider working with a trainer to evaluate your form to be sure you're using your knees safely. Number 5. Vitamin D Deficiency. A simple vitamin deficiency may be causing your joint pain. It can be difficult to reach your recommended vitamin D intake, especially if you don't make an active effort to get outside or eat a balanced diet. Researchers say that the longer you are deficient in vitamin D, the worse your joint pain will get. Eventually, you can develop arthritis or bone problems. Just 10-20 minutes of natural sunlight may give you the vitamin D you need. However, if you can't get outside, other sources of vitamin D are foods such as salmon, mushrooms, tuna, and egg yolks. Supplements are also a great way to get your daily vitamin D intake. Number 4. NonStop Texting. Typing, texting on your phone, dicing food, and other activities that make you repeat the same motion over and over can tax larger joints like your shoulder, as well as smaller joints like your thumbs. The solution is simple: take a break every 2 to 3 minutes. Try to avoid the activity if the joints it uses already don't feel so great. For example, call instead of texting, and use a headset if your conversation will last more than 5 minutes. Number 3. Skipping the gym. Exercise is a crucial component when it comes to maintaining healthy knees because it keeps your muscles, bones, and connective tissue strong. At the same time, you should avoid putting repetitive strain on your joints. To protect your knees, DRS recommend participating in daily forms of moderate exercise that build strength, stamina, and flexibility. Great low-impact activities often include walking, biking, swimming, yoga, and strength training. And don't forget to spend 5 to 10 minutes warming up and cooling down before and after the activity. Number 2. Anxiety. What you may not know is that joint pain is a complex symptom of anxiety. There are many reasons that people who have anxiety feel increased joint pain. Stress inflammation is one of the most common issues inside the body. Pro-inflammatory cytokines are molecules that can be released by many things, one being stress. When you have anxiety, you experience long-term stress, and as a result your body continually produces these cytokine molecules. Inflammation caused by these molecules causes your joints to swell and ultimately leads to more pain in your movements. Number 1. Smoking cigarettes. By now, you know that smoking cigarettes cause many negative health benefits. Add joint pain to that list. Smoking is addictive because nicotine causes the body to release dopamine, which makes you feel good. It tricks the body into feeling less pain at first, however, when that feeling wears off, the pain is often worse. Cigarettes also affect the body's circulatory system and inhibit nutrients from flowing to the muscles and joints. Since your muscles help to protect your joints, when they are not receiving the proper nutrients, your joints are more susceptible to pain. Back pain and neck pain are also common in smokers because of the coughing symptom that many smokers experience. If you have chronic knee pain, or if you severely injured your knee and are still in pain a few days later, you could be setting yourself up for a permanent injury. You either need treatment or you need to strengthen your knee with physical therapy, bracing, or other therapies so that your joint can rehabilitate and be pain-free again. Your knees bear the brunt of taking your body from place to place. The joints are constantly in motion with almost every move you make, whether it's standing up, sitting down, walking, climbing stairs, or crouching to pick something up. Knee pain can make every move a misery. So, take care of them. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.